Tonight, the plan to vaccinate Utahns against COVID-19 is undergoing some changes, derailing the original timeline of who will get vaccinated. Fox 13's John Franke explains what this means to Utahns and the most vulnerable. John.
Well, hey, Callie, first I want to explain that this does not impact those essential healthcare workers. They're getting their shots right now. But folks who work in grocery stores or possibly the airport, industries that are deemed essential, well, they may have to wait a bit longer.
That's really key. If you think about it, which population is most risk for severe illness, hospitalization, and death? That group. Age is probably your greatest risk factor for a severe infection.
The Utah Department of Health says that group is people aged 75 and older. That's why they are now the focus of phase 2 of the state's vaccination plan.
Trying to make sure that the people who are at the highest risk for the most severe disease have access as early as possible to the vaccine.
The state's COVID-19 statistics are driving that decision. 935 of Utah's 1,219 COVID-19 deaths, or 77%, have been people older than 65. That same group accounts for 38% of the state's COVID-19 hospitalizations, despite representing just 8% of all cases.
If you think about why do we vaccinate folks? Well, we vaccinate them if we can save their life, if we can save severity of disease.
In a statement, Governor-elect Spencer Cox says this decision will save lives. Dr. Todd Venta with Intermountain Healthcare believes protecting older Utahns will take some of the strain off doctors and nurses who've been stretched thin since March.
Which patients are most sick? Well, let's vaccinate them so they're not the ones coming to the hospitals.
According to the state's timeline, these phase 2 vaccinations will begin in February, with phase 3 hopefully starting in March. Vigilance and patience will still be important, as the vaccine will need some time to make an impact.
We have to develop the immunity. You have to get the second dose. You have to wait for that development of immunity. But the sooner we start doing those things, I would say you would start to see at some point in time, probably months, not on the order of weeks, but maybe months, even further lowering of hospitalization numbers.
And right now, we're in phase 1 of this vaccination rollout plan, and that does include teachers and school staff. They should start getting their shots by late January. Again, this plan is evolving, and the health department working through a lot of little details as they try to get this vaccine out to as many Utahns as possible. Reporting live on the Hill, John Franke, Fox 13 News, Utah.